Okay, so our medial palpations, we're going to have our first metatarsal right here. And if we palpate proximally, we're going to come to protrusion, and this is going to be your first cuneiform. And then this is going to be your first metatarso-cuneiform joint. And then if we palpate proximally, we're going to come to the navicular tubercle. And then if we continue to palpate proximally, we're going to come to the head of the talus, which is going to be below the medial malleolus. And then, so if we move superiorly, we find the medial malleolus. And then if we go 2 inches, or about 2 finger widths, below the medial malleolus, we're going to come to the cestinaculum tali, and this is the attachment for the spring ligament. And then below the medial malleolus and superior to the head of the talus, in this space right in between here, this is going to be the medial tubercle of the talus. And then if we go to the lateral side, we have our 5th metatarsal. And then if we palpate the head of the 5th metatarsal, this is going to be the styloid process of the 5th metatarsal. And then if we continue to palpate proximally, the heel of the foot is the calcaneus.
Lateral aspect of the foot, you'll find the lateral malleolus at the distal end of the tibia on the lateral side. Now on the calcaneus distal to the lateral malleolus, you'll find the peroneal tubercle, and this separates the peroneus brevis and the longus tendons. Now if you palpate the depression anterior to the lateral malleolus, it contains the extensor digitorum brevis. This will be your sinus tarsi. And if you invert and planar flex the foot, you can see a protrusion of the dome of the talus, and that is what that is. And the inferior tibial joint is proximal to the talus, and it's hard to palpate, but you can find a small depression here which indicates that joint. Now for the dome of the calcaneus, you can go posterior and find first the calcaneus, and superiorly to that, medial and lateral to the Achilles tendon, you'll find the dome of the calcaneus. Now for the medial tubercle of the calcaneus, you'll go almost opposite, if you will, to the planar medial aspect of the foot, and this will be your medial tubercle of your calcaneus. Now for your sesamoid bones, there are 5, and they're at the bottom of your MCP joints. Here's 1, 2, 3, 4, and 5. Now if you planar flex the foot and you're looking for the metatarsal bones, they are behind the MCP joints, and if you place your middle finger or your hand at the back end of the foot and put your thumb to palpate each one, you can flex and extend each toe and find the correlating metatarsal bones.
The dorsal pedal artery lies between the hallucis longus and the dorsum of the foot, and it is usually absent 12 to 15% of the time. The ATF, or the anterior talofibular ligament, is found when you're inverting the foot and it's planar flex. This is going to be from the lateral malleolus, the anterior portion, to the lateral aspect of the talar. You can't usually find it unless there's a defect or inflammation found. The calcaneofibular ligament stretches plantward from the posterior side of the malleolus to the lateral wall of the calcaneus. The posterior talofibular ligament will be found from the posterior edge of the lateral malleolus to the small tubercle of the calcaneus. The peroneus longus is found when you evert and planar flex the foot. This is the peroneal tendon. This is going to be the peroneus longus and the peroneus brevis. The retrocalcaneal bursa will be found right here behind the Achilles tendon, and the calcaneal bursa would be 1 finger outward just between the skin and the Achilles tendon. And the plantar fascia, also known as plantar aponeurosis, is found on the medial tuberosity of the calcaneus. and splays outwards towards the toes.
Okay, so now we're going to palpate zone 3, which is the medial malleolus, and the first one we have is the deltoid ligament. So to palpate this, you want to grab your patient's forefoot or calcaneus, whichever you prefer, and have them evert their foot, so bring your foot out that way. And this ligament right here below the medial malleolus is your deltoid ligament. And it's really the superficial part of the foot that's palpable, like in a healthy ankle. Then next we have a tibialis posterior tendon. And from the medial malleolus, you kind of want to go posterior to that. So have your patient invert their foot and then plantar flex against your hand. So go down and in. And then this area right here is the tibialis posterior tendon. And then just behind that, we have the flexor digitorum longus tendon. And can you kind of go against my fingers? So I'm having the patient flex against resistance, and then this tendon that sticks out right here is the flexor digitorum longus tendon. And then you can't really palpate the next one, which is flexor hallucis longus tendon, unless it's extremely symptomatic, but that's right posterior to that, and it goes a bit higher. And then you have posterior tibial artery, and that's in between the two tendons that we just palpated, the flexor hallucis longus tendon and the flexor digitorum longus tendon. Then you have your tibial nerve, and that one you can't really palpate as well unless it's extremely symptomatic, but it's posterior and lateral to the aspects that we just palpated. Then for zone 4, dorsum of the foot between the malleoli, you have your tibialis anterior tendon. And to get that, you want to have your patient dorsiflex and invert their foot against resistance. So go up and in. And then this prominent sticking out right here, if you palpate distally, this is the tibialis anterior tendon. And then relax. And then laterally, next you hit the extensor hallucis longus tendon, and you want to have them bring their big toe to their nose. So do that. And then this area right here, this tendon is the extensor hallucis longus tendon. And relax. Then the last one for this video, you have extensor digitorum longus tendon, and then you want to have them do the same thing with their little toes. So bring your little toes to your face. And then this prominent right here that disperses into 4 segments is the extensor digitorum longus tendon.